My name is Kelvin Ramsey. I'm a consultant plastic and reconstructive surgeon working in London. My NHS hospital is the Royal Marsden Hospital, which is a cancer hospital on the Fulham Road in Chelsea. And I also have a private practice at a number of hospitals in central London. I decided to become a doctor from a very early age, having grown up in a medical family. My mother was a doctor, my father was a medical physicist, and so I was brought up in that environment. I was taken onto the wards at a very early age as a young boy and got to see firsthand on those occasions, and also in my home life, what a wonderful opportunity medicine was. I saw how much my mother helped patients on a daily basis, and that really sparked my interest. Then going through school and my education, the sciences, and particularly biology and anatomy, really sparked my interest and pushed me forward towards what was an inevitable choice for me. Really, it was my main interest growing up, so it was an easy decision to make. So, having gone through my basic training in medicine, you got exposed to all of the different surgical specialties. The decisions you make as you go along during your training are initially medicine or surgery. And I really relished the idea of the hands-on approach of surgery and the ability to fix people. So I went through all the different surgical specialties, and a lot of them interested me, but the move into plastic and reconstructive surgery was a game changer. As soon as I moved into training in plastic surgery, I could see the wonderful opportunities that we have for improving people's lives after going through trauma or cancer, or just making the adjustments to the body that will really have a huge effect on people's physical and mental well-being. The other elements of my role is doing reconstructive surgery, and some of that involves microsurgery, which is very technically challenging, but something that I got very interested in early in my training, and spent several years doing fellowships both here and abroad to finesse my skills, and that has set me up for my consultant career to a significant extent. I'm lucky enough to be able to say that I find a number of factors of my job rewarding. From a reconstructive point of view, if me as a plastic surgeon is involved in a cancer patient's journey, it's generally for a good reason, because it means that the cancer can be cured with an operation, and I will be there to put them back together and reconstruct them to sort of finish their surgical journey. So I'm lucky enough to be in that fortunate position and help those patients through the final stages of their treatment before they move on with the rest of their life. So that is hugely rewarding. And in my private practice, a lot of my work is partly cosmetic but partly reconstructive. So, for example, I saw a lady for a breast reduction today, and breast reduction surgery is hugely beneficial. You can change these ladies' lives with a short operation and a short period of recovery, but take the psychological and physical benefits of these operations is immense. So seeing these patients through these journeys is incredibly rewarding. I think from the feedback I've had over my last 10 years as a consultant and in my training is the honesty that the patients appreciate in my consultations and while looking after them. It's important to highlight the benefits and the outcomes of the operation, but also explain what the journey is going to be like and what are the things that could go wrong, hopefully very rarely, but also make sure that they're fully informed about all of the considerations as to what they're undertaking. And a lot of my patients leave the consultations saying, thank you, that was extremely helpful, that was extremely enlightening, and I really appreciate your honesty. And I think that's important. We are primarily doctors, and we are helping these patients, and we must inform them fully, not just talk about the benefits of what we're doing for them, but also explain what other considerations need to be taken into account.